Hello, I'm Dr. Anaga Karkhanis. I'm a gynecologist. I work with women in perimenopause, menopause, fertility, and I also manage midlife weight and metabolic health. Today, we are going to address something that I see very often in my clinic. A woman in her 40s comes with weight gain, fatigue, brain fog, and she asks, Doctor, is this my thyroid or is this perimenopause? This confusion is extremely common. Now, let us understand why many health problems appear in the 40s. Around the mid 40s, many women suddenly notice rising blood sugar, prediabetes, that is raised HbA1c, cholesterol changes, fatigue, joint pains, and autoimmune flare-ups. It feels like everything started all at once. The reason is timing. Perimenopause is not just a reproductive change. It is a whole body endocrine transition. Estrogen has influence on multiple organ systems like the brain, blood vessels, fat tissue, muscles, immune system, pancreas, everything practically. So when the estrogen fluctuates, multiple organ systems will react. Now, coming back to the question, does perimenopause cause thyroid disease? A very important clarification. Thyroid disease and menopause are influenced by separate gland systems. The ovaries produce estrogen, progesterone, and some amount of testosterone, while the thyroid produces thyroid hormones. One does not directly control the other. So, thyroid removal or hypothyroidism does not cause menopause. However, symptoms overlap, like fatigue, hair fall, weight gain, low mood, poor concentration. This is why many women think that they only have a thyroid problem when they are actually entering perimenopause. Both conditions can exist together, but one does not automatically cause the other. We have also heard of inflammation increasing in perimenopause. Estrogen has an anti-inflammatory effect in the body. So when estrogen declines, inflammation increases. At the same time, body fat shifts towards the visceral fat, which is actually an inflammatory tissue. Fat is not inactive. It releases inflammatory molecules. More abdominal fat means more inflammatory activity in the body. This partly explains why some autoimmune conditions worsen in the midlife. Perimenopause may not directly cause autoimmune disease, but loss of estrogen's anti-inflammatory activity is likely to contribute to the flare-ups in some women. Now, let us discuss an important risk, the diabetes risk. As visceral fat increases, insulin resistance also increases. Insulin is the hormone that actually moves glucose from the blood into the cells. So when the cells become resistant to insulin, the blood sugar rises, pancreas produces more insulin, and fat storage also increases. This is the pathway towards type 2 diabetes. After menopause, the incidence of type 2 diabetes rises significantly in women. This mechanism is mainly because of low estrogen, increased fat tissue, and insulin resistance. And this is why a woman who was always healthy becomes pre-diabetic in her 40s. This is not a lifestyle failure. This is a metabolic transition. Another important factor, the cardiovascular risk. Estrogen also protects the blood vessels. It maintains the flexibility of arteries and influences the cholesterol metabolism. So when estrogen declines, your LDL cholesterol rises, plaque formation increases, and so your cardiovascular risk also increases. After menopause, heart disease becomes a major health risk in women. This is well documented in the cardiology research. So, midlife care is not only about symptom control, it is preventive health care. So, if a woman presents with belly fat, fatigue, poor sleep, high sugar, and rising cholesterol, she does not need only a diet chart. Evaluation matters. She needs assessment. And this will include metabolic markers, body composition, thyroid testing, and menopause evaluation. Treatment is not a one-size-fits-all. Some women may benefit from lifestyle intervention, some may benefit from hormone therapy, and some may need metabolic or weight management treatment. All require monitoring and medical supervision. Perimenopause is not a single system condition. It is a systemic hormonal transition affecting metabolism, immunity, and cardiovascular health. And understanding this helps remove the guilt and replaces it with clarity. In the next video, we will discuss modern weight loss medications and how they actually work in the body and why appetite is controlled by brain, gut, and not just willpower. I'm Dr. Anaga Karkhanis and I'll see you in the next video. Thank you.